We all know how important our health is, but we often ignore the health workers, especially the nurses. Today, we will look at the safety of nurses at workplace. Before diving into it, let's look at the introduction and background of safety of nurses at their workplace. Workplace safety refers to the presence of measures that minimize the risk of physical or psychological harm. Nurses' sense of physical and emotional safety in the workplace translates into greater nurse satisfaction and better patient care. Every nurse has the right to work in a safe environment, free from the threat of illness or injury brought by their job. Now, let's look at the data of physical injuries among the nurses. About 70.4% of the hospital nurses from South Korea had experienced needle stick or sharp injury. In British Columbia, 2,784 injury incidents involving time loss and/or medical attention. Let's look at the musculoskeletal injury in nurses globally. African region 63%. United States and Canada region 43%. Asia 32%, South American 34% and Australia and Philippines 24%. So, what are the causes of these physical hazards? Let's have a look. Number 1, electricity. Nurses often get electric shocks caused due to short circuits, loss of power and improper wiring. Number 2, due to equipment handling. Some equipment are sharp, heavy, difficult to handle and hence hazardous to oneself. Number 3, wet floor. While regular cleaning is important, but there are too many incidents of accidents in hospital due to wet floor. Number 4, radiation. X-rays, lasers have caused too many hazards to the nurses. Number 5, combustibles, alcohols, spirits, etc. There are a number of chemicals which have been a cause of harm to so many nurses so many times. When we look at the impact of these physical injuries to the nurses, it's quite disturbing and disheartening. These include, but are not limited to, deafness, burns, blood disorders, cancers, musculoskeletal injuries, and even heart stroke. So, obviously the nurses needs initiative for change for their own safety. Some initiatives that has been taken are: create awareness related to workplace physical injury. Inform their immediate supervisor or manager as soon as possible. If necessary, get medical help and care immediately after the occurrence, but no later than 24 hours for severe injury. Later, report the injury to the Workplace Safety and Insurance Board. Work with the WSIB, the employer, and other authorities to cooperate in any investigations or evaluations that they carry out. Document any medical care received and any time absent from work because of injury. Let's look at the ways of minimizing physical injuries among nurses. 1. Education. 2. Equipment. 3. Health and safety policy. 4. Multidisciplinary collaboration. 5. No lift policy. 6. Promotion of a healthy lifestyle. 7. Culture of safety. Along with these, the ethical, moral and legal responsibilities should be of National Nurses Association, employers, nurses, healthcare professionals, nursing professionals, regulatory organizations, labor unions, local governments, nurse educators and researchers. Here is what the ICN recommends. General recommendations are: wear appropriate PPE. Follow standard precautions and infection control protocols. Know your workplace policies and procedures. Avoid working alone. Maintain good communication. Use proper lifting techniques. Take breaks and rest. Keep emergency equipment and supplies readily available. Participate in safety training and drills, and seek support from others.